Thank you, Mariam. Kate, welcome. I know you've done an event with the philosopher before, so welcome back. Uh,
Thank you. Thanks so much
thank
for having me.
thank you for being here, and thank you for writing the book that you did, which again, I found really enjoyable and refreshing because I think, like you said in the description, it's part memoir, part polemic, part kind of philosophical analysis, which again, you don't see being done very much in philosophy. People are very afraid to bring themselves to the table. They're very afraid to say their stories or even talk about emotions. And again, reading through it, I very much felt seen. I used to be a fat kid when I was younger, and the reason I know this is because everyone used to tell me I was a
Mm.
fat kid when I was younger. And so when I was reading these stories about, again, you growing up in Australia, going to school, I grew up in India, a very different part of the world, but very much could relate to so many of your experiences. And so just want to say thank you so much for writing with such honesty, vulnerability, and just being so honest, because again, a lot of the time you're ashamed to share these experiences because you're taught to kind of shrink or hide. And I think this book isn't doing that. This book isn't shrinking. It is unshrinking, and it's loud. It's very much telling you what it wants to say. And so my first question was going to be kind of, what was your thought process about writing this book? Why did you choose to take this approach? And just kind of any kind of thoughts or considerations you had about taking the approach.
Yeah, well, first of all, thank you for that really meaningful and lovely um, sense of your reaction to the book. It means a great deal to me because, in a way, the posture of the book, in a kind of bodily sense, was about lifting my head out of the shame that I'd long experienced around my body and my fatness. And um, the visceral experience of writing it was kind of lifting my head up from this shame-faced posture of head down, eyes lowered, and trying to kind of meet the reader's gaze in a way. So it means a lot to me to have reactions like that that feel about relating to these experiences. They feel like expressions of solidarity, and that's what I really wanted the book to elicit in readers. Is I wanted the question I was asking the book in the book to be something like, "This is my experience. How about you?" And of course, people will have experiences that have similar dimensions, very different dimensions, but also, yeah, I wanted that bodily solidarity to be the basis. And beyond that, I guess the reason why it was important to me to write this book was that I found when I wrote my first two books, which were about misogyny, a lot of people would ask me, well, how did you get into writing about misogyny, thinking about misogyny? It's, a topic that's pretty depressing, as my 4-year-old says. It's not very fun. Um, and I found that this question that was very natural about why I started writing about misogyny couldn't be answered without also telling a story about fat phobia, because the kind of misogyny that I encountered first in my life in a really pointed way was when I was 16 and one of three girls at a formerly all boys high school. Um, and the all boys high school had integrated that year, admitting three girls. And it was a very male dominated, misogynistic environment where, as a fat girl, the form misogyny usually took was kind of weaponized fat phobia against me in virtue of being, yeah, then I would say a chubby teen. And yeah, just the sense of my body as wrong really haunted me. And I wanted to explore that and, yeah, provide a basis for solidarity for all of those of us who've been made to feel in various ways that our bodies are a problem, that they're wrong, and that we need to somehow fix them.
Yeah, yeah. And I guess speaking of solidarity, you do say it's not just a few of us, it's a lot of us. And the prevalence of fat phobia is kind of astonishing. But like you said, unlike other forms, again, misogyny, patriarchy, we've been talking about that a fair bit. I think now people would apologize if you call them sexist, but people still don't apologize when you call them fat phobic. They in fact justify. Their
it's
ability.
just not healthy, blah, 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 which, we can get into, but is often a dog whistle for, I find fat people gross. I think that they're responsible for the way that their bodies are, which is often very misleading because most of us who are fat don't choose fatness. I would add that even if we do choose fatness, I think that's a valid choice. But I also think that fatness is typically unchosen. And yet there is this sense of, yeah, your body is just wrong. Yeah, I mean, I think that's a very important point about the way the dialectic often works here, because when we think about how many people are fat, it's about between 2/3 and 3/4 of Americans. It's similar in my country of Australia. It's similar in the UK. It's like a majority of people have at least a claim to fatness. And that means that in some ways you would expect us to have made great social progress in this attempt to, as fat activists, really create an environment where fatness is not frowned upon, it's not shamed, it's not shunned, it's just another valid way of having a body. Um, and that we embrace the fact that bodies just come in different shapes and sizes, and that's a normal and I think actually beautiful part of human diversity. But instead of that solidarity, what we find is that a lot of fat people are very understandably desperate to shrink ourselves. I mean, I've been in that boat for the majority of my life until the last, 5, 6, 7 years. And so instead of forming a political movement in solidarity with the kind of rich tradition of fat activism that I learned about in the early 2000s, looking at work by Kate Harding and Leslie Kinzel and Marion Kirby and more, instead of forming part of that movement, people instead regard themselves not as a self-identified fat person, but as like a thin person trapped in a fat body waiting to escape after the next diet or exercise or diet pill program. And so instead of forming together and saying, no, you have to treat us better, we actually tend to be like trying to escape a condition that for many of us is just the way our bodies are and will be for most of our lives, with temporary, variations in weight. Certainly people temporarily lose weight after diet and exercise and diet pill programs, but the weight tends to come back pretty inexorably. So I suggest a more enlightened perspective would be regarding oneself as a larger person and
Yeah.
thinking about that as the basis for political action.
Yeah. And in some way to accept that as your
Yeah,
identity.
exactly. Yeah.
When I first started reading your book, the earlier chapters are a lot of studies. And at first I was like, oh my goodness, like what? But then eventually, once I finished, I was like, these studies were really important to go through because I think you can't even get into the philosophy until you recognize empirically fatness does not mean you're not fit.
Yeah, I mean, this is the thing where I was actually a bit reluctant to get into this debate about the relationship between weight and health, but I think because it's a topic on many people's minds, I kind of had to get into it. And the truth is that the relationship between weight and health is nuanced.
Yeah.
It is, not a simple matter of more fat on the body equals worse health. The relationship between fatness and health can be captured very roughly speaking by a kind of U-shaped curve with, to many people's surprise, people who are in the quote unquote overweight category of the BMI, which the body mass index is racist garbage. We can get into why in later questions, but just let's use it as a metric to have a sort of reference point for the discussion here. So having a quote unquote overweight BMI is the lowest mortality rate statistically speaking for people. So that's where people have the lowest chance of premature death in the overweight category. And then we find that people who are in the quote unquote normal weight category have the same mortality risk statistically as people in the obese category at the what's called class 1 obesity end of it, or moderate obesity, which is having a BMI between 30 and 35. So there's basically no statistical reason why we would assume, based on the evidence, that people are more likely to die prematurely before a BMI of about 35. And then even at more elevated BMIs where you do see increased mortality, there's just a lot going on. So when I point out that this is a U-shaped curve, part of what that means is being underweight is statistically risky, as is being very fat. However, people who are both underweight and very fat have lots of things going on. We don't really have trouble seeing this when it comes to people who are underweight. They may have illnesses, they may be smokers, they may have other comorbidities. Similarly, with people who are very fat, they are the people who are subject to inadequate health care, the stress of weight-based stigma, often not having access to the means to exercise in ways that suit their body because people are publicly belittled for exercising above a certain weight. And then we wonder why there are bad health outcomes in that category. Now, could it just be the fat itself on the body? Yes, that's possible. But we do not know that, given that there is a ton of correlations with stuff going on that we know influences health negatively, like, for example, not receiving adequate health care and screenings. So yeah, this is part of the message in that chapter, that the correlation between fatness and health is complicated, and correlation between being very fat and unhealthy doesn't mean that being very fat necessarily causes the ill health. It could be that there are other intervening and confounding variables there. And so the upshot is that we have to be very careful about what is essentially, I think, often a fat phobic dog whistle of, well, I just care about your health, or I just want you to be healthy. The reality is more that that's a way of casting aspersions on fat bodies in a way that is laced with disgust and moral judgment, and impugning fat bodies without real regard to this complicated evidence that is difficult to summarize quickly. You know, it took me a good couple of minutes to go through it, and that doesn't provide a basis for quick, easy assumptions that people like to make about larger bodies.
No, and for all of those people who are still not sure, go read Kate's book. Because again, there's loads of studies. You can go read those studies if you want, but the evidence is out there. Speaking of kind of health, I think if you are kind of a younger person who is fat, you do form kind of a scared relationship about going to the doctors. Because again, they're kind of shrouded in this shroud of objectivity, and they're just looking out for your health. When in reality, it's kind of a judgment day every time you go to the doctors. And I was wondering if you could walk us through some of the other medical harms of working with the assumption that you're only unfit because of your weight.
Yeah, completely. I mean, so I think it's really important to see that the whole medical system is systemically oppressive to people in larger bodies. And I say this as someone who identifies now as a small fat person at the small end of the fatness spectrum, and so who has a certain amount of privilege in this regard, which I think is important to acknowledge. But there are lots of folks who go to the doctor's office and their medical encounter involves stigma from the beginning. There may not be chairs that they can use in the waiting room. There may not be a blood pressure cuff that fits their arm. There may not be needles that are suitable for being intramuscular and so on. This is a big issue with vaccinations, by the way, of fat people getting inadequate vaccinations because we're simply not getting long enough needles. Just a simple thing of having to weigh in at the doctors, regardless of whether the medical encounter involves any question relevant to weight. It really underscores this assumption that health and weight are in lockstep in ways that are not accurate, especially as you just mentioned, given the fact that I think it is fair to say, based on the evidence, that it is fitness, not fatness, that matters most, and fat people can be fit And that can be a very protective measure for one's health, which is bad news for me as someone who hates to exercise. But it turns out being fit and being fat are perfectly compatible, and fitness is really important. Exercise doesn't tend to take a lot of weight off most people, but it is really good for most people if they find a form of exercise that suits their bodies and, you know, is sensitive to potential illnesses, disabilities, chronic conditions, and so on.
Yeah.
So the medical encounter, though, will be like, well, what do you weigh? What's your BMI? Often involving this shaming aspect and also this really patronizing aspect that assumes that fat people haven't heard of things like diet and exercise and haven't like become inured to this sense that their body is a problem in ways that mean that oftentimes for physicians, bringing these topics up is just going to lead to more shame, more stigma, more reluctance demonstrably to go to doctor's appointments and seek medical help, and isn't really imparting new information. So weight inclusive physicians like Dr. Mara Gordon, who's doing wonderful work in the US and writing about her experiences as a weight inclusive physician, are just bypassing the weight piece of it and saying, well, let's look at more fine-grained measures like what is, for example, your blood pressure? What does your blood work show? Are you getting enough rest, which is a really important question about health? Do you need certain forms of support? And can we brainstorm ways in which you need more social support? These are ways of approaching the medical encounter that will be less likely to produce this very predictable outcome of fat people basically becoming more reluctant to go to the doctor as their weight increases, and thus often not getting crucial preventative care and care for chronic and acute conditions, meaning that real problems go undiagnosed. And when people do seek care, they're often told, just go home and lose weight.
Correct.
Whatever the symptom and whatever, you know, it would actually help with this problem.
And you do share stories about cases where this has had some really detrimental outcomes for people, where they really needed the care and they just didn't get it.
People have died because they have gone to the doctor and the doctor just sees a fat person. They say, go home and lose weight. And the case with which I opened, the woman, Jan, who went to the doctor, and this is recounted through the eyes of her sister, she was just dismissed for being a fat, complaining older woman. She had very bad abdominal pain. She tried to lose weight. She tried to alter her diet. She tried, you know, things like cutting out gluten and dairy and exercising more. Meanwhile, she had the biggest endometrial tumor that the physician who eventually operated on her, or the surgeon who eventually operated on her, had ever seen. And she died of after rounds of chemotherapy 6 months after this was discovered, where she had spent years not receiving a diagnosis because they just assumed she was a fat, complaining older woman, according to her sister, who has written about this posthumously. And there is another case that I look at in the book, that of the patient Jen, who was told to just go home and lose weight after having a baby when her kidney levels were all over the place, and it turned out that she had bone marrow cancer. So again, people are just being told, lose weight as a panacea in ways that really obscure that they are in urgent need of, say, cancer treatment. Yeah, it's tragic and it's preventable and it doesn't need to happen.
And it's got some really serious, like fat phobia, has some really serious
Kills
consequences that
at
people
its
sort of
worst.
don't realize. Not only do people think fat people are just complaining and need to lose weight, people also think fat people are lazy and intellectually inferior. And I do love how you kind of just break down, like, it's not just other professions, it's also philosophers who share some of these views.
Yeah, and this was a big one for me, obviously, given my profession, no pun intended, because look, I am someone who has really for a long time often felt anomalous in a discipline that I'm not the first to observe this, is really dominated by thin bodies. So it's famously a very white male dominated profession in ways that I think are pretty terrible. It's a transphobic profession in ways that I bemoan. And, you know, it's classist, ableist, and more. But the fat phobia of philosophy, I think, has gone somewhat more under the radar, and yet a lot of our exclusionary ways of talking show up pretty directly in the classroom, where we come in, you know, one of the first lessons many people teach in their Ethics 101 classes is the trolley problem, where you're comparing a case of a trolley that's about to kill 5 people. So do you divert it to you know, save the 5 and kill the 1? Or the case that's the variant of this is just called the fat man case, where that involves, instead of diverting the trolley to save the 5, you're going to push a fat man off a bridge in order to stop the trolley in its tracks and kill him and save the 5 that way. And the disturbing thing about that case is both that it didn't need to be set up that way, but also that it makes the fat man a figure of fun. Like, students are giggling when they're hearing this case. His body is kind of a punchline. I mean, it's a case that has you know, serious moral principle that's at stake behind it. Is it better to kill in a more remote way, or is it worse to kill in an up close and personal way, or is that just that we're more squeamish about it? So that's a serious question, but it's kind of framed as, oh, this like funny character of the fat man who we just imagine as a suitable site for violence. And that's in our first day of teaching ethics for many of us. I mean, I've done this myself, and I've always called him a large man or a man with a backpack, or I've tried to couch it in terms of like, look, this is the classic example philosophers use. It's somewhat problematic, but let's roll with it. But I just, the more I think about it, the more it sets people up to think of fat people as disposable and dispensable in ways that are actually just unethical. We're doing ethics in a way that is not ethical. And I go through, this is just one example among many, where we set up fat bodies as these anomalies that are kind of in the way. Like, there's another Philippa Foot case where the fat man is blocking the mouth of a cave, and you have to decide whether to blow him up with a stick of dynamite in order to stop his body that's anomalously large from blocking the mouth of the cave, thus trapping people inside. So should you kill him with the stick of dynamite in order to, like, should you obliterate a person who's fat, is basically the question. You know, in order to save more people. But the way it sets up the fat body is, let's just say, not my favorite. It is making the fat person other. It is making them this kind of obstacle in the way of things going smoothly. And it's making it into an instrument of like both humor and, you know, it's making it not just a figure of fun, but someone whose body is ripe to be exploited for both comic effect and to save more people.
Yeah, or that they're just a body and not a mind. Like, they're just there to be thrown on the tracks, which is just kind of bizarre. And again, you don't clock it because fat phobia is so prevalent that I've done this trolley problem myself.
Yeah.
So kind of more recently, where I've been thinking about fat phobia, I've kind of just accepted it.
Yeah. No, it's same. There is a way in which the fat body in philosophy is thought of as a sign of a mind that is weak and a will that is acratic, or, you know, weak-willed, someone who's not fully in control of themselves, someone who is irresponsible. Yes. And so this is both empirically false, like it's not true that fat people eat more or worse than thinner people. Largely, this is a matter of genetics and metabolism and what we have access to, and, you know, what medication someone takes, and stress and hormones and pregnancy and all sorts of reasons why people are larger that have nothing to do with willpower. And frankly, for many fat people, we have a lifetime of dieting behind us that makes our will iron. Like, this is not something where we're actually unable to control our appetites. We're highly controlled in our appetites because we're punished for not being disciplined. And yet there is this sense that fat people are both out of control and also just stupider than thinner people, which again, it's so obviously false and it's so obviously bigoted and prejudiced, and yet it is everywhere, like in our culture. And philosophy provides a lens of seeing both, I think, how irrational that is and how ubiquitous it is, even in sort of high-flown and highfalutin art forms and modes of intellectual tradition like philosophy. You find a lack of critical thinking about how actually a fat body is just a fat body, and it doesn't mean that the mind is somehow lesser or slacker or, flabbier. We could even, as Carmen Maria Machado says, change our metaphors and view fatness as a metaphor for like expansiveness and creativity and being intellectually ample.
Yeah.
And yet instead we talk about prose that's flabby and a kind of lack of muscularity or a lack of robust argumentation in ways that, do tend to make fatness into a metaphor for intellectual
Laziness.
problems and
Yeah.
laziness. Yeah.
Yeah. You did mention dieting and the control that comes with it. And it is true. I think every person who struggled with fatness and weight has tried all sorts of diets. And I just want to talk about the kind of controlling behavior and anxiety that that leads to.
Yeah.
And you talk a lot about gaslighting, where we're taught to believe we're doing something wrong.
Totally. I mean, the way I think that this is linked to diet culture is, perhaps obvious, but fat phobia is at the root of this problem. But diet culture sets up dieting as a means, a viable and smart means to the all-important end of thinness.
Yeah.
And I think we're often subject to these messages that say that the kind of suffering involved in chronic dieting and even the sort of disordered eating and eating disorders that are very, very common for chronic dieters to develop, that doesn't matter. That's in service of this all-important, morally, intellectually, aesthetically, and health-wise worthy goal of being thin, where, yeah, you should just suffer. And that's just the price of beauty and health and being intellectually respected and seen as morally good. And yet, like in so many other areas in ethics, we recognize like suffering is bad, something that makes you feel chronically deprived and hungry and sort of like in need. We have no problem recognizing that as important when it is due to, say, political conditions and famine and natural disasters and so on. And yet a world of people who have the means to be eating wholesomely, but who are depriving themselves is seen as kind of an ethical non-issue.
Like an ethical imperative. Like you
As
should.
positively good.
Yeah.
Exactly. And that's really strange when you think about it. Now, I agree that being hungry as the result of being deprived of food is worse than being it self-imposed hunger. But self-imposed hunger is still bad, and it's still under coercive social conditions, namely that of patriarchy and white supremacy and misogyny and diet culture. And so the gaslighting aspect to it is it kind of turns this like strange practice of making us chronically hungry to no good end, because study after study, huge meta-analyses show that diets simply don't work. Being on a diet does not make people thinner in the long run. So even if you endorse that end, this is not the means to get there, actually. And so we have this pointless suffering, but we're gaslit into thinking that that is not a problem. And in fact, just as you said, is morally obligatory or at least salutary. And that's really strange. Like, isn't that a strange result that we have kind of gaslit people into thinking they should do this thing that study after study shows is not going to make them thinner, even if they want to be, which we can question that goal, but many people do. And it's going to make them suffer, but they should do it anyway. Like, how did we end up with a population deluded into doing this? Well, I think part of the answer is cultural gaslighting that says
It's because there's lots of money behind these industries.
100%.
And I think this is also where you call bullshit on the fact that people care about your health, because it's really about the aesthetic ideal, because we do have conclusive research that weight cycling is bad for you and dieting is bad for your mental health. So anyone who says you should do it for your health is clearly not, like, that doesn't add up.
That's exactly right. I mean, again, these studies don't suggest you can't lose weight through diet and exercise, especially dieting. It's just that it's very temporary. Like the weight comes back almost inexorably for the vast majority of people. And
Yeah.
so what we find is people go up and down in weight as a result of dieting, and that has been shown to be independently bad for people's health, regardless of starting weight. Leads to cardiovascular problems, it leads to metabolic problems, it increases rates of things like type 2 diabetes, it leads to immune dysfunction and mental health problems that, not least of which is it greatly increases risk of eating disorders. Like one of the biggest triggers for an eating disorder, unsurprisingly, is being on a diet. And so, it's a little tricky to separate cause and effect there, but it at least seems to be a potent risk factor.
Yeah.
And so then we wonder, like, oh, well, why are we obliged to do this for our health if it's actually going to make you less healthy to be weight cycling rather than just maintaining a certain weight that might be larger than is deemed socially acceptable, but it's just where your body comfortably is. And so that's the question that I think is exactly apt here of, how did we gaslight people into thinking this is for your health, where actually demonstrably it's really about appearance.
Correct.
And an arbitrary norm that has historically been quite different. But now thinness is harder to achieve in a calorie-rich social environment, and so it's deemed better, where, again, just because something's harder doesn't mean it's necessarily more virtuous or more valuable or more worthy or anything else. It's just harder and not necessarily good.
And you're so right about the changing kind of cultural dimensions of it, because I'm always caught in a double bind. Because my grandmother, who grew up in India, values bigger bodies because they had food scarcity.
Yes.
My parents, who kind of grew up in the kind of 80s and 90s, value smaller bodies. And there's always that juggling where you're like, there is no inherent correct or healthy weight. It more just depends on what you value based on the society in which you were raised.
Yeah, completely. And this is a really interesting and common feature of cultural norms around body size. If there is food scarcity in living memory, oftentimes people do value having more flesh on the bones in order to, just have more of a calorie reserve for times of, potential hunger and, lack of access to calories. And that makes complete sense. But then we don't kind of relate it to the fact that as we entered this more calorie abundant social environment, then that became less valued, and we began to value the thing that is associated with elite economic status. And I would also add whiteness, especially in Anglo-American culture, which is thinness, because thinness now is that which takes the most money and leisure time and privilege and all sorts of resources to maintain. So that becomes a marker of social status. And then we have this narrative that says, oh, that's what's healthy and worthwhile and virtuous, which is really just window dressing for the fact that this is a way to advertise high socioeconomic status. And conversely, having a larger body is a marker of lower social status oftentimes, and is a kind of proxy for things like marginalized racial, socioeconomic, and also gender status.
Yeah, exactly. It does intersect with loads of things, like you said, classism, racism. We are at 40 past the hour, and it is time for audience questions.
Great.
I could keep going, and
Yes, your questions are so great.
that I haven't covered yet, which again, people will have to go to the book to find out more about. But let's look at audience questions. I will start with Eddie's question, who asks, can you say a bit about what your views suggest about how we should think about the new diabetes drugs like Ozempic, which are used for weight loss?
Yeah, that's a great question. Thank you for asking it. I mean, these drugs are, I think, very positive developments for many patients with particularly type 2 diabetes. And I don't want to in any way minimize the fact that they have been very, very useful for many patients with that condition and also some other conditions. Like I've heard from a lot of people who have been using these drugs, which are known as GLP-1 receptor agonists, semaglutides and liraglutides, and similar classes of drugs for things like PCOS. So that leaves then the question that is being asked here about what we should think about these drugs purely used not for independent health benefits they have that I in no way dispute, but for weight loss. And here is where I unsurprisingly have some concerns. One thing that we should be clear about at the outset is we just have to do the math on these drugs. And there has been in the popular discourse a sense of like, oh, we've solved fatness. This is a magic bullet. And that's obviously not true. If you look at studies of these drugs, even studies that are, the ones that are most sort of flattering to the drugs in terms of efficacy because of the classes of patients who've been studied, they're going to take between like 8 and 15% of someone's starting weight off on average, with some patients losing a bit more than that, some patients losing no weight at all, but that's about the average. Now, that's a bit more than diet and exercise has traditionally done in the short term, but it's not a lot more. It's not orders of magnitude difference. Think about it like this: for a 300-pound person, they might expect to lose between 30 and 40 pounds. That is still going to leave most people who are 300 pounds still classified as very fat, and as obese in the medical establishment. So one thing to just note here is that we kind of still need all of the systemic aspects of fighting fat phobia that we did before. Even if the entire population who is fat started taking these drugs, we'd still have fat people who need justice and compassion and adequate health care and, a sense of our basic humanity and so on. So that's one point to make, that these drugs have been like somewhat overhyped in terms of what they do. Another point to make is obviously they have a lot of side effects for some patients. Now, these are variable. Some people report having a pretty smooth experience on them. And for some people, it's a kind of merely unpleasant set of symptoms, usually things like gastrointestinal distress, and feeling kind of gross after eating, like finding also less pleasure in food. And those side effects might be, unpleasant for some and tolerable for others. But we also get some patients who are experiencing really serious side effects, things like gastroparesis or ileus, which is essentially gut paralysis and the complete obstruction of the gut in ways that can be life-threatening. Now, that may affect only, say, less than 1% of patients, but if you already have at least 10 million Americans taking these drugs, that's a large population of people who will be having gut damage that there's no clear way of reversing that gut damage. It's something which some people don't actually recover from, and is tremendously serious gastrointestinal effects. So yeah, I'm worried about the side effects. I don't want to have a discourse that overhypes the effects of these drugs as much as I think is currently going on. And I would just add that I posited a conditional a moment ago, which is even if every fat patient took these drugs, what should we think about them? Well, blah, blah, blah. But not every fat person is getting access to these drugs. There is radically different levels of access depending on socioeconomic status and also depending on things like race and gender. So 80% of people taking Wegovy at the moment are women, and the majority of those are white women. The majority of those are affluent white women. And a lot of those people are those who don't necessarily have any statistical reason to be concerned about their weight and are doing it to lose weight for aesthetic reasons. And that's really worrying to me, that we're getting a kind of return clearly of the thin ideal for people who don't even have an elevated risk of premature mortality based on their weight classification, because they want to look as thin as is becoming increasingly trendy right now. So
Yeah.
does that answer the question that it's, again, a nuanced picture, and these drugs are great for some folks? And I also want to just add one thing. I know this is a long answer, but I also just want to say, if you are someone who is on these drugs, I am just wishing you nothing but happiness, success, peace, like no shade to an individual who takes these drugs. What worries me is the social practice. I think it's so understandable to want to lose weight in this way and others. I just worry about people, and I think people are entitled to do that, but I worry about people feeling obligated to do that because of both generalized fat phobia and because of the particularly pointed return of fat phobic beauty ideals that the age of Ozempic has ushered in. So that's my concern. Nothing but love to individuals on this journey, which I know is a fraught one. And I don't doubt that 10 years ago, I would have jumped at these drugs. So yeah, I say this from a place of real compassion, not judgment.
No, and it is right, like you said, the social pressure that's compelling you to do it, very similar to the way we even talk about cosmetic surgery, where if that's what you need to do to achieve an aesthetic ideal, like good, like more power to you. But the question is more kind of a more sociological one, which is why do you feel compelled to do it?
Totally, totally.
The next question we have is from an anonymous attendee who asks, the erasure of and discrimination against fat bodies reminds them a lot of erasure of trans bodies. And they were wondering if you have any thoughts on this systematic discrimination against all bodies that differ from the norm, like disabled, trans, fat, etc.
Oh, I love this question because that is a big theme in the book, especially in the last two chapters. Just thinking about bodies that are valid and valuable and instantiate beautiful forms of human diversity, like trans bodies, queer bodies, disabled bodies, fat bodies, where we're nonetheless systematically derogated in ways that I think call for this kind of reclaiming of our right to exist in a way that is not, a cause for interference, a sense that our bodies are wrong, a sense that we need to be fixed, that we just need compassionate, affirming care, actually. And so, yeah, a big theme in the book is that we are wronged bodies, not wrong ones. There's nothing wrong with any of these ways of being in the world. They're actually valid and valuable. And that I think the kind of pride that has been so movingly and powerfully demonstrated within queer and trans communities, and also in racially marginalized communities, and in the disability pride movement, is also part of what needs to happen within fat spaces, and has been happening for a really long time, but could even get stronger and increase in terms of the proportion of fat people who embrace that sense of fat pride that I see inspiration from when I look at, my trans friends and disabled friends in terms of their involvement in these forms of like joyous activism and prideful activism.
Yeah.
So yeah, thank you for that. Great question.
I did see some of that in deaf culture as well, where a lot of people are like, it's not a disability, it is just our way of communicating. And it really is about taking pride. Speaking of, there was one question which I thought was quite direct and maybe helpful for some people, where John asks, circling back to your joint exposition of the medical encounter, what is your experience of potential methods of advocating for yourself in such asymmetric and prejudicial dynamics?
Love that question. I think a really good question, where here I'm inspired by the wonderful fat activist and researcher Reagan Chastain, is to ask, if you're told to like go lose weight after a medical encounter, to say, okay, what would you tell a thin patient with the same symptoms as me? What would you try? And if they say, well, but I want you to lose weight instead of trying this, medication or this physical therapy program, say, I want it noted in my chart that you are refusing to prescribe this treatment or refer me to this particular kind of provider. Because that just puts them on notice that, yeah, you are not someone who is messing around, that you take your own care seriously, and that you are willing to self-advocate. And yeah, I think that can be, admittedly, that is, it takes a lot of, chutzpah in the moment to say those things. I don't always have the strength to say them. And that can be also a reason to do this third thing I wanted to mention, which is bringing in someone to advocate for you if you have moments where that becomes difficult, as it is for most of us. And some fat patients say it's really helpful to them to bring a thin spouse or friend or, support person who can do that advocacy when fat phobia arises. And that's really important work for anti-fat phobic allies to do, is doing that medical advocacy when a fat patient needs that support, because it is a really triggering moment.
Yeah. And again, it might just be one of those environments where you don't feel comfortable standing up because you have been belittled in those spaces over and over. There's a really
Totally.
nice question by an anonymous attendee who asks, do you have any advice on reducing feelings of disgust about your own body? Can you explain why so many of us continue to feel this, even though we may not be able to recognize the fat phobia, and even though we may be able to recognize the fat phobia and capitalism behind it? It's just that we're constantly saturated with messages about it. I think it's a
Yeah,
good question.
that's a really powerful and poignant question. And the answer that I offer in my conclusion in the book is not body positivity, and it's not body neutrality. So these are kind of well-known options, like love your body, be positive about it. I'm again sending all love to anyone who finds that works for them. It doesn't work great for me. Like, I'm not a very positive person about anything, so why would I be positive about my body? Like, what a fraught thing to have to be positive about. It feels a bit oppressive. It feels like I'm being required to have like mind control in ways that feel icky. And similarly, like body neutrality is better, I think, as an option than body positivity, for me at least. But it's also a bit depressing to be like purely neutral about your body. And I began to think when I was writing the book, like, why do we need one monolithic kind of judgment about our bodies at all, unless there was this prospect of body negativity that is so ubiquitous? Why would we need to be ranking bodies on a scale whatsoever? So instead of thinking I'm going to be positive or neutral about my body as an alternative to negativity, my mantra became, my body is for me, your body is for you, and so on and so forth for anyone in the world, any non-human animal, I would add. And the idea, then I call that body reflexivity, is the body is actually not really ripe for judgment. Like, I should feel no more disgust or pride in my body than I feel like disgust or pride or praise for like any part of nature that I don't feel the need to assess. Like,
Like
I can appreciate it. Sorry, go ahead.
my eyesight, like I don't feel pride about my eyesight. I don't feel bad about it. It's just neutral.
Yeah, or not even neutral. It's not even on the scale.
Yeah.
Like, the scale just doesn't apply. It's just like, think about the attitude we might have that we go out in nature, we see a tree, we see a sunset, we see a rock. Like, none of these things require like sunset neutrality or sunset positivity or rock neutral. It's just there. It's just there, and it might be working better or worse for you, its denizen. But that's the only thing that matters. And so for me, like, when I say my body is for me, my feelings of disgust and potentially pride just fall away. It doesn't happen automatically. It's not like this perfect panacea, but I find that mantra really powerful for me. And I've offered it to readers and offer it here now as like, um, hopefully a helpful way to say to yourself, like, it's just not up for aesthetic assessment. That's just not what bodies are for. We're not there for correction or consumption or comparison. There's no scales.
No, and I do like what you say about kind of your partner in the book. I think it is about surrounding yourself with people who kind of make you feel that way, who don't look at you with a critical eye, like who really just see you as you.
Yeah.
I think that's really important because sometimes you can be having these feelings, but you're surrounded by people who don't actually believe or that fat phobia is a concern, or who do buy into the fact that big bodies are disgusting or wrong. And then it's really hard to still kind of maintain that feeling in yourself.
Totally. Yeah, I think there is a really hard task for anyone in the larger body to navigate all of the messaging that really conspires to make us feel like we need to change and we can change and we need to completely, like, radically rethink just our bodily being in ways that are not feasible for the majority of us. And that is something which I think it is enormously hard to push back on as individuals, which is why it's really not on the individual to like feel positive or practice self-love. It's really about addressing the structural fat phobia in a way that requires political solidarity and coalition and a movement.
Yeah. And I guess this goes back to what we started with, which is that this book provides solidarity in some way. Even though you're not physically known to the reader, you are sharing your story. And in some way, we can all realize that we're not all just going through this kind of by ourselves. This is something that affects other people. And I think with kind of constantly surrounding yourself with that kind of messaging, you can really kind of shed some of that feeling. But again, like you said, disgust is a unique kind of emotion, isn't it? In that it is so deeply conditioned.
Yeah, I mean, one of the studies that made me really concerned about fat phobia writing this book was the finding that implicit bias in nearly every category seems to be decreasing except for weight bias. So they studied here implicit bias against people on the basis of race and ethnicity and skin tone, disability, sexuality, age, and all of those forms of implicit bias were decreasing except for fat phobia, which was on the rise. And it was also the form of explicit bias that was decreasing the most slowly. So I think this shows that like we really need to try to make progress on the issue, but it's very sticky. It is very much something where people are not just skeptical, but actively hostile to someone whose body has always been larger, who does the things that are health promoting demonstrably, like exercising and eating healthfully and getting enough sleep and so on and so forth, but whose body is simply larger. That person will be subject to not just questions and comments and assumptions, but active hostility and aggression.
Yeah.
And that is something that I think is a real psychic and political, it takes a toll in both psychic and political respects. And yeah, part of why I was motivated to write this book is I just want better for anyone.
Yeah.
Having a body is hard, and it shouldn't be made harder by kind of outright bigotry on a basis that is so, in the end, arbitrary, so historically recent, and also so cruel oftentimes.